Hello, Happy New Year, friends. It's so good to have you all here. Welcome, welcome, welcome. I'm so excited to have you here. My name is Priscilla, and welcome to the first episode of 2021 HTV podcast. My name is Priscilla Ozodo, and we are glad that you are here. For those of you who are joining us for the first time, this is an ICON podcast, and ICON is the International Committee on Nigeria, and we promote human dignity, the right to live, religious freedom, and the protection of the vulnerable against all forms of persecution in Nigeria. That's why we're here. I do this every week, and while I don't know, I always lose my phone at the moment we're supposed to do this. So I'm going to say, pick up your phone. We want to invite as many people as can to join us in this conversation. So if you're subscribed to us, you should get a notification on Facebook or something. So I'm doing just that. It should say icon is live. And so I click on that and it's showing me talking. And you just click the share button. It's kind of weird because I'm watching myself go. And you click share, post. And there we go. You don't know that by doing that, you might get 2 more people, 3 more people, 5 more people to be able to engage in this very, 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 very important topic. So thank you for sharing. If you're following us on YouTube as well, you should have gotten a notification on YouTube to say that we are live. If you haven't followed us on YouTube yet, what do you call it on YouTube? Subscribe. Subscribe to our channel on YouTube. Y'all have mercy on me, you know. This social media thing is, we're all learning it, okay? It's such a joy to be present in this 2021. Just to give you a little bit of a gist, in this new season, we're going to be talking about speaking up for the issues in Nigeria. We're going to be featuring people that want to speak about the persecution that's happening in Nigeria. We'll cover topics like, how is COVID affecting these issues of persecution? What are food insecurities that have come up? How can we deal with the kidnapping pandemic that started way before the COVID pandemic and has been going on in Nigeria? We'll talk about the lack of security and the lack of safety that people feel in Nigeria, as well as the power of youth and women in Nigeria. So you don't want to miss any of this. You want to be here every Tuesday at noon and share it with your family and friends and your cousins and your enemies. But I'm excited to be here with you this morning. If you can tell, I am. And to learn more about ICON, you can follow us on our social media. We'll talk more about this, but go to iconhelp.org and get more information. Follow us on Instagram, Stand With Nigeria. Follow us on Twitter. We want to create a community, and I said this before we ended the year last year, is follow us on Facebook, and we thank all 5,000 of you that are following us on Facebook. But we want to form a community where we talk to each other and check in with each other and share news articles with each other on Instagram. So if you follow us, all 5,000 and plus of you that follow us on Facebook, follow us on Instagram too. It will make me really happy. And let's get the conversation going there, okay? All right. Thank you for everything, and it's a joy to be here. And now for the news of the week. All right, on today's news, we want to talk about the fact that, as most of us anticipated this past Christmas holidays, how many of you had fun? Christmas, New Year, excitement? Did you get presents? As we look forward and enjoy the Christmas season with joy and excitement, Christianity Today reports that many Nigerian Christians approached this Christmas season with fear, anxiety, and an expectation to be attacked by terrorists. Not to have Santa coming down the chimney, not to receive presents, but an expectation to be attacked by terrorists. Was there a good reason for their fear? Was there a good reason for their anxiety? Well, reports show that over 2,000 Christians were killed by the Islamic extremist groups in Nigeria in 2020 alone. Pause. Breathe. 2020 alone, over 2,000 innocent Christians were killed in Nigeria. The International Society on Civil Liberties put the total number of deaths of Christians since 2009, and this is a conservative number, at 32,400. Speaking of genocide, with a further 20,000 moderate Muslims being killed. So there's a slaughter of not just Christians, but also moderate Muslims. Well, this fear, the fear of being attacked over the Christmas and New Year holiday, came to a reality because we received reports that the Islamic militants publicly executed Christian men in Nigeria. These men who were publicly executed on camera were amongst 11 people who were kidnapped from their homes on Christmas Day in Garkida, Adamawa State. The Islamic State, West Africa province, is often called ISWAP, attacked Garkida on Christmas Eve and Christmas Day. And they later released a 49-second video of the execution. They bragged that this execution was a warning to Christians around the world and in Nigeria. One of our sources revealed the names of these martyrs, and I'm going to say their names so that we don't forget them. It's very easy for this to be a number, and we've done a lot of hashtags, say their name, say her name, say this name. I want to say the names of these 4 men that are representing 4 families that were killed in cold blood. 5 men. Uka Joseph, Sunday, Wilson, Joshua Meidugu, Garba Yusuf. We pause and ask that God will grant peace and comfort to the families of these men, to their loved ones, and to the thousands and thousands and thousands of families that have lost loved ones to senseless killings by extremist and terrorist groups. We can't afford to remain silent, y'all. It's time to speak up for Nigeria. It's time to stand up and make a difference. It's important to note that these killings happened on Christmas, over the Christmas break, and there has been no official statement or response from the Nigerian government to confirm or to say what is being done about these killings. Another kidnapping occurred in Damaturu Maiduguri Road in Nigeria. Boko Haram insurgents kidnapped an aid worker this past Sunday. No, it didn't stop. Sunday, January 2nd, 2021. We're in a new year, and the same things are happening. Abubakar Garba Idris was on a private trip to Damaturu and was abducted by terrorists dressed in military costume. You know, y'all, this is where I get stuck. I don't get how you get stopped thinking you're being stopped by the authorities or by the security forces, and you're being stopped by terrorists who are trying to kidnap or kill you. These terrorists were dressed in military costumes. He was kidnapped alongside 2 other passengers who were later released on the grounds that they were very poor people and have no use to be abducted. This kidnapping pandemic has continued to plague Nigeria and has escalated during this holiday season. There was an escalation notice. I read news about several Christian leaders who are being abducted and held for ransom. And thankfully, some of those Christian leaders have been released. But this continues to happen. In other news too, the chief imam of Kwaran Rafi in Igabi local government area of Kaduna State was killed for allegedly preaching against the insecurity in the north. This is a Muslim clergyman. His name is Dan Liman Isa, and he was gunned down in his village when armed bandits attacked his home and fatally shot him in a premeditated fashion. It wasn't just a robbery. It wasn't just, there was a plan, and he was killed in his home with his family watching. Y'all, this is a lot of heavy news. So I was preparing for this news, and some of you who follow us on social media saw me break down yesterday, because it's easy to just read this. I want to encourage you, first of all, before I go into our last news of the day, to follow us on Facebook, because we post a lot of this news articles on Facebook, so you can go there and read them for yourself, because we're just giving you highlights. But sometimes you want to engage in the story. I was engaging in the story in ways that I had never done before, and my heart was broken. And I said, when will this end? Let's not despair, because in spite of all that's happening, that is why we're here, to bring awareness to the world, to let people know that this evil is happening in Nigeria. Thankfully, we're not the only ones raising awareness about what's going on. On some good news, an episode of Cannon's Class with Nick Cannon, which I was kind of tripped, y'all. I don't know about you, but it's Nick Cannon, like the Nick Cannon. You know, he hosted a conversation with Reverend Johnny Moore, who is known and loved by Icon, and Rabbi Abraham Cooper, who together they wrote the book, The Next Jihad, Stop the Christian Genocide in Africa. They had a roundtable discussion to bring awareness to the persecution and genocide of Christians in Nigeria. The beautiful thing was they weren't just writing theoretically, they actually went to Nigeria, interviewed hundreds of people, and wrote this book. Now, the good news is not just that, this clergymen went to Nigeria themselves and reported their findings in a book that anybody can order right now on Amazon. Go order the book. It's called The Next Jihad, Stop the Genocide in Africa. If you're one of those people that you're like, I want the numbers, I want to hear the stories, I want to encounter, go get the book right now. Amazon doesn't pay me, but I think you should go buy it. Also, I really appreciated this because Nick Cannon has a large audience, and the book can be read by everyone, but Nick Cannon's Class is a huge platform that discusses these issues. Right now, he has gained over 7,000 views, which we're trying to get you all to share our stuff so we can gain like 1,000 views. But, I'm just plugging this in to share. But the joy in my heart was where our voices cannot reach, other voices are being heard. The voice of Reverend Johnny Moore, the voice of Rabbi Abraham Cooper, and the voice of Nick Cannon is being heard. Just to recap, y'all, the evil is still happening in Nigeria. And while we had a Merry Christmas and a trust in the Lord for a very blessed New Year, what are you doing today to make a difference? What are you doing today to make a difference? The easiest thing you can do, and I say this every week and I'll keep saying it until I sound like a broken record, is the easiest thing you can do is click share. That's it. Shikena is what we say in Nigeria. That is it though. Click share. Get this message out there. Let people on your feed know that you're standing with Nigeria. We're going to say that so often. It's going to be hashtag stand with Nigeria all season long for the next 3 months. Because we want your voice to be heard, not just ours. Your voice can go to places where our voices cannot. So it's in light of this that I'm really excited to bring in our guest today. While the persecution in Nigeria is still going on and is still very real, it's important to note that there's still another very real health concern, and there has been health concerns. It's not like this persecution is happening in a chasm of a perfect world, There have been issues around the topics of COVID-19 and malaria. And we just want to talk about not just what's happening in Nigeria as a whole, but how can people in this persecuted area how do they have access to healthcare in the midst of a pandemic? So to discuss this today, I'm going to bring in my first guest. My first guest is Terver Marc Akindigh, who before I tell them all the wonderful things about you, I want to just shout out that you're an amazing musician. And I featured him on my first album, and we did a duet together, I think. And
That's right.
and I'm like so honored to have you here right now. Just in case anybody wants to know, you're like one of the most talented musicians I have met, and I'm grateful for you.
Oh, thanks a lot. It's really been a while. It feels like music is in my rearview mirror, but I have fond memories of times that we've shared
You
and
better go and find it from
connected.
your rearview mirror. Go and find the music from your rearview because music, your voice is not just separate and distinct, but very anointed as well. And I believe God still has plans to use you in that arena. But we'll come back to the topic of today. Okay, back to business. I'm just
Fabulous.
going to read a little bit of what I have about you for the guests, for our audience here today. Um, Teve is a Nigerian researcher with more than 15 years experience working in the healthcare space. He has worked on projects involving HIV, hepatitis, and malaria research. And currently, his research activities focuses on collaborating with tertiary healthcare facilities in the study of non-communicable diseases such as diabetes, cardiovascular diseases, as well as understanding resistance to anti-malarial drugs. So, Tevi, that's your resume. That's the beautiful thing. But can you just introduce yourself to our audience and let them know, who is Teve and what makes Teve happy or sad, or what's your passion and why?
Okay, so Taylor is um a researcher. As you mentioned, I've had experience working in health, and I think it's something that is really personal. I'm really committed to making a contribution that influences what happens to health. As they say, health is wealth, and so I've invested a lot of my time working in that space, and it's a passion that I have. As you also mentioned, I love music. I've 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 carried music everywhere that I go.
Yeah.
I haven't had the chance to record as much as I did in another life, but it's something that drives me, and I always consider that um, this part of me that is a researcher and that part that is a musician are just two sides of the same coin. So
Mm.
there's nothing different about these. Um, every now and then you have one part of the coin flipping over and you have the other flipping over. So yeah,
Mm.
that's TV.
Teve, tell me what got you into health research in the first place? Like what is that thing inside of you that connects to health research?
So it's something that is really personal. I feel like it's a personal vendetta,
Mhm.
particularly my interest in studying malaria.
Mm.
Um, Many years ago, I lost a sister
Mm.
um, to malaria. At the time, she was just 7,
Mm.
and as we know, malaria is a disease that um, has a lot of impact on little children and pregnant women. These are major risk groups. And just thinking about how helpless I felt being a little boy, seeing my sister in that situation was something that propelled me and continues to drive me.
Mm.
It's something that can be avoided, it's something that can be prevented,
Mm.
and there's a lot of work to do. And so this is my contribution,
Mm.
and that's what constantly propels me.
Hmm. I love that, Terry. Thank you for sharing that. And I'm sure your sister will be very proud of you and the work you're doing on her behalf about malaria. People don't know that malaria has been killing a lot of people in Nigeria, but I just want to zoom in a little bit about access to malaria testing, especially when
Mhm,
we're looking at everything today from the context of the persecution that is happening in Nigeria, right? And the killings
mhm,
and the terrorist activities, the kidnapping, the lack of safety. Um, how would you describe the access that the average person, maybe in an area ravaged by persecution, what kind of access do they have to malaria treatments? And when they don't have that kind of access, what happens?
Yeah, the effects of the persecution that happens in many parts of the country has led to fear, you know. So even in places where a lot of what can be used to help in cases like malaria, you're having people afraid to go to those places, like a primary health care facility. In these places, people will not want to go there, right? And so it reduces the chances that lives can be saved. You
Hmm.
know, there's a lot that foreign aid does in terms of providing some of the test kits and also the drugs that can be used in
Hmm.
treatment. But when people are afraid to go to those places, and even the healthcare providers being afraid to even go to work, you know, it reduces the chance that the healthcare professional will be able to help those who will come to their facilities. And it's something that continues to reduce um, the the benefits of the work that we do.
Hmm. Around your work, I don't know if you've been involved at all in COVID testing, and would you say that's something that people have access to in this time of the pandemic?
Not directly, but because I work with a lot of healthcare professionals,
Mm,
um, I might have like some idea of what happens. Um, if you look at the numbers from Nigeria, you would see that we still have not been able to test up to 1 million people. And when you look at it in context, you see that Nigeria is a more than 200 million, population.
mhm,
And if less than 1 million people have been tested since the pandemic started, um, it means that we have tested less than 1% of
mm,
Nigerians. So what that means is, um, yes, there's a lot that is being put in, but um, COVID allows us to begin to see the deficiencies that exist in our healthcare system,
yeah.
right? And so it also brings its own version of the strain, on our healthcare system.
Mm,
And we're grappling with COVID as an urgent emergency, but
mhm,
then we also have monsters like malaria lurking in the dark,
mhm,
and also doing their own damage.
hmm. Whew. You spoke about the breakdown in our healthcare system, um, and what does and my other guests will talk a little bit on this, but I want to get your perspective. What does poverty have to do with healthcare in Nigeria? So does the
Oh,
amount
yeah.
of money somebody have determine the kind of treatments they have access to? So for me, for example, I traveled, I came back, I did the drive-through, got this thing stuck on my nose, did a COVID test like that without ever thinking of an expense or
Mhm.
thinking of money or so what does expense have to do with COVID? Not just COVID testing, but access to good healthcare in Nigeria.
I'd say that the government has really tried a lot to, provide access to COVID testing for the
Mhm.
population. But again, you know that there's a distrust that people already have.
Yeah.
They can tell that the system is broken,
Mm,
and for many people, they still don't even believe that COVID is real, because of the deficiency that we have in the infrastructure that can allow testing to be increased. All
mm,
right. And so what you have when people do not have access to healthcare, health insurance, that allows them to be able to walk into a health facility, get tested, and get drugs that they need. It definitely limits the ability of the individual to be able to have treatment for whatever it is that they have. Then add what COVID brings to the table. You also have people not being able to, particularly in rural areas,
Yeah.
migrating into the places where government has been able to deploy the facilities that can allow them test. Then when you throw in the insecurity and throw in the persecution that people experience, they will be unwilling to make the trips to travel to where they can
Yeah.
be able to access whatever is being offered.
Hmm.
And in all honesty, um, there's a lot that needs to be done.
Yeah.
There are gaps, no doubt. There's a lot that people are doing, philanthropists, um, industries, companies, they're making a lot of investment, but um, poverty is a real terror that prevents everything that is being done to trickle down to those who really, really, really need it.
Hmm. Thank you so much, Terver. I just want to highlight something that you said about the distrust. Will you just a quick response? Will you say that distrust is majorly because of the lack of security and the killings that have happened so far?
Um, it will be about a lot of things and not just that.
Hmm.
There are a lot of things. Um, just recently, we had the NSARS
Hmm.
protest, that was widely publicized, along with um, the response that seemed like happened, the killings that happened in the midst of that.
Hmm.
How does that not amplify the distrust that people would have
Yeah.
towards what the government will do? Again, we know that there's a lot that has happened. It has taken a long time for the systems to tear down and have all the damage that it has. It will take a lot to build all of these things back to where we're able to have all of this. And just looking at how enormous the work is, sometimes people are skeptical, like, is it possible to do this? And then
Yeah.
when you have the
That was my
response
next question. That was my next question.
yeah,
What can people actually do? Like people who are watching this and they're like, this is just such a big problem. There's NSARS, there's Boko Haram, there's militants. What can people do? Not just the average Nigerian watching this, but people in the US. And if you can just very briefly just respond, what is the response? Is there hope and what can people do?
oh yes, there's hope. There's hope, and a lot of people are making the sacrifices in spite of the insecurities. There are healthcare professionals who are Christians who take the risk to go to these areas that
Mm,
have insecurity and take what is needed.
mm,
Again, there's a lot that can also be done by people who are watching this who aren't in Nigeria.
mhm.
Um, you know, you can speak up. You can speak up. Many times it takes amplifying those voices that are silenced by the persecution and what cannot be heard. And what Icon is doing is one of those vehicles that can allow our voices to be heard and everyone to know that these things are happening. Again, uh, contributions can be made, to change
Yeah.
policies, right? When people know that there are defects that can be changed, right? Um, it makes the government wake up
Mm,
from its slumber, from thinking that everything is fine because they are in their high towers or they're in
yeah.
places where they don't have access to these things, right? It just allows um, everyone see that there's work that needs to be done, and the government can wake up. Yeah.
We can all work. Thank you so much, Terver, for joining us. We are grateful. We pray for all of your work. And I will be calling you because we got to do music together again. So,
Yeah, we need to do that. We really need to do that. Thank you so much, Stella. Love the work that you're doing with Icon, AJ, Kyle, and the team. God bless your work. And whatever we can do from this end, we are sure partners in this work. Thank you so much for bringing me on.
Definitely be taking you up on that word and doing some partnerships. I look forward to that. Thank you so much. It's a pleasure to have you, Terver. We have one more guest for you this afternoon, and this is a special guest to me. Terver joined us from Jos, Nigeria, I believe, and this next guest is Dr. Nkechi Ozodo Akinwale, and I say that because she's my little sister. Welcome, Nkechi, to the studio.
Thank you very much.
Yeah, Nkechi's here. She graduated from the University of Jos with a medical degree and has worked in both public and private sectors of the medical setting. So, Nkechi, tell us just a little bit about yourself. You know, if I introduce you too much, I'll start bragging on you because you're my sister. So tell us a little bit more about yourself.
Okay, I'm Nkechi Ozodo, popularly known as Ozodo, but Nkechi Akinwale now. I'm a medical doctor, like she said, but I'm not the typical medical doctor. I'm that very atypical medical doctor. Like to gist a lot, like to play with children, and I love Jesus, and I'm in my profession not because of the medical field per se, but to make a difference in the world. Yeah.
Thank you so much. I just want to make a correction to something I said before. Terver lives in Lagos, so we both our guests are from Lagos, Nigeria. Okay, Nkechi. I know you all should hang out. Terver, you should hang out with Nkechi. Anyway, Nkechi, from your perspective, describe the effects of the COVID pandemic in Nigeria, particularly when it comes to this pandemic being in the midst of the persecution and the killings we are seeing.
Okay, could you take the question again? Sorry.
Yeah, I said from your perspective, can you describe the COVID pandemic and its effects in Nigeria, particularly as it may be affecting areas that are ravaged by persecution and killings and insecurities?
Well, for me, the COVID situation in Nigeria right now, especially as it affects the persecuted areas, I would say that we've not been able to treat anybody in those areas as far as I'm concerned, because they are handling something else, and then we're talking about something else. And I would like to say that most people in Nigeria, especially where I work in a community hospital somewhere in Ibadan, Lagos. To most people, COVID-19 does not even exist. People are facing other things like poverty. People are being armed robbery is on the rise, and we're talking about so many problems in the society, and then you talk about COVID-19 and you're like, please, that's not even exist. And they see you wearing a mask every day to work, and they're like, doctor, why are you wasting your time? There's nothing like COVID-19. So it's been for me a struggle trying to convince people that there is actually something called COVID-19. So that's the situation we've got from here.
Wow. So do you think the reality that there's all of these other issues going on is blocking the reality that there's a deadly disease out there? Is that kind of what you're
saying? Yes. Yes, that's exactly what I'm trying to say. I'm trying to say that in Nigeria, especially in Lagos, the part of Lagos I'm in, which is a part where it's like a slum. It's not. I'm not Lekki. I'm not in the Victoria Island. I live in a slumish part of the city. For me, I mean, for this environment, they don't even believe COVID-19 exists. because in my hospital where I work,
Mm-hmm.
I mean, we've not had any casualty, we've not had any death from a sickness that looks similar. I say similar because we're not even exposed to the testing kits or to the testing materials. I know you're coming to that, but I just want to throw that
Mm-hmm.
in there. We don't even
Mm-hmm.
have it. And when you send people for the test, they are like, God forbid, we don't have it in Jesus' name. So you get what I'm saying,
Yeah.
right?
Yeah.
But we're not even dealing with that at all right now in the part of the country I live in.
So if somebody walks into your hospital with what
Yeah.
you see, what you perceive to be COVID symptoms, what do you do? Because from what I'm hearing, you don't really have access to testing at your hospital. So if
Oh
somebody
yes,
walks,
we don't. So
so what do you
the Nigerian Center for Disease Control, sometime in April, came to the hospital as part of their epidemiology plan.
do?
So
Mm-hmm.
they came there and brought phone numbers like these are helplines. When you see a patient, give us to call this number. And it will shock you what I'm about to say because even right then in April, when it was really more scary, we
Mm-hmm.
called the numbers and they go, do they have any relative that just traveled from the US? Do they have any relative that just traveled from the UK? Okay, we don't have time for that. We don't have time to test those kind of people. They are not priority. And that was what was going on then.
Hmm.
Okay, now January 2021, when you call them, they're like, okay, you can come to the center at so place, and the place is so far, and it's very difficult to describe. It's so
Hmm.
difficult that they're like, you have to use a bike to lead you on to the place. And it's very clumsy. And I'm trying to convince this patient, oh, you have the symptoms, go for test. And they're like, where do I go? And I'm like, okay, I'm coming. Let me call NCDC. And I call and they start saying a long story. Like, oh no, I don't have it. I'm not going. So how do we get tested? So so far in Nigeria, we've done 980,046 tests by today.
Hmm.
So, like Terver said, that is not up to 1 million tests.
Wow.
And we've had like 1,351 cases confirmed so far now by today in Nigeria.
Hmm.
That's not even up to 100,000 confirmed cases. But I'm saying, are those really the numbers? And are those really the confirmed cases? Because we don't even have access. I, for one, have never been tested for COVID-19. And I've been working in the health facility every day, almost all through last year, and I've started again this year. So the
Hmm.
facilities are not as accessible as they should be.
Okay. So Nkechi, I'm just gonna kind of bend the conversation a little bit to what we are about here at Icon. And we talk about this communities that are ravaged by persecution, genocide, and killings. And I know you've done some rural work and some going into rural areas to take medical care. If it is this hard to get to a medical facility in Lagos, to get to a testing facility in Lagos. Can you describe and paint the picture to our audience how difficult it might be for somebody in Maguzawa or somebody in some village, rural area that is ravaged by, the killings of militants and Boko Haram, where people are scared? Can you paint a picture based on the encounters you've had in some of the rural areas? Can you paint a picture of how easy do you think it will be to even get awareness and testing of COVID?
Okay, I like to say the word awareness again. You said awareness. I think that's where we should start from. I mean, not the testing, awareness of the testing.
Mm-hmm.
Initially, when the disease started in the world, it was really more scary than now. When we saw the numbers, we saw people die on TV, and we're just holding our hands and waiting to start dying. And when we didn't really die of COVID-19 in Nigeria, it became
Mm-hmm.
kind of hard to convince people, especially people in the rural areas. I mean, what are you going to tell them? They're struggling with poverty. They're struggling. How easy will it be? So I think, I don't know, because I'm not there in Magizawa or in the far north, or I'm not there, but I want to assume that it will be really difficult, because right where I am in the city, in Lagos, it is very difficult. So I don't think they have hope at all. That's my opinion.
Nkechi, last week we interviewed some people, some of our friends and volunteers for ICON that go into the villages to give awareness and distribute masks in very, very rural areas. I want you to address our audience a little bit about how their support can help spread the word. If you had people supporting you, what are some things that could happen? What are some things that could change? I know you've had patients that you would love to help out. What are some things that people who are watching can do to make a difference in Nigeria today, right now?
Okay. Right now, sorry, I'm going to go back to the numbers. Right now, I believe that our numbers are wrong. So one of the ways people can help us is to give us face masks. Let's start from as basic as that. Because I was speaking to my cousin today. She's a pharmacist in the UK, and she was saying that what she fears most for Nigeria is that most of the people are carriers, and we are asymptomatic patients. So we're not really, we don't really have the symptom, but does not mean that we don't have the disease. And she was just saying how ordinary, just a face mask, an ordinary face mask can help prevent transmission to other people. And I like to say that currently in the hospital I work, I have two suspected cases already, and they happen to be elderly people. So I'm saying that the elderly are at risk. And if we, the young ones, at least wear a face mask, we can protect those people from getting it. So one of the first and fundamental ways you can help us, whoever is watching, wherever you are in the world, you can help us provide face masks. You can help us provide just hand sanitizers. These are things you can help us with. Even hand gloves to work in the hospital, for goodness sake, can help to stop the spread of COVID-19 in Nigeria. It looks miraculous to us now that people are not coming down, but trust me, the second wave is already starting. Unlike the first time that I didn't see any patient at all, I've already seen 2 suspects within this week. So I think we should double up on our efforts. We should not just make awareness by speaking. We should actually do something. We should educate the public on the use of face masks, and we should actually use them.
Thank you so much for that, Dr. Nkechi Akinwale. Thank you for joining us at this time. I just want to emphasize something she said before I say goodbye to her. I want to emphasize that by supporting ICON and going to iconhelp.org/give hope, I don't know if we're still like /give hope, but you can actually give to ICON and say to go to medical facilities to provide masks and gloves. And Nkechi is my sister, and I worry for her a lot because she doesn't have PPE. We didn't even talk about that. She treats all these patients without PPE, with just gloves and a face mask. How safe do you feel?
Actually, I feel very unsafe, and I feel that I'm just walking by grace and by faith. I don't feel safe at all. I approached my boss. It's a private facility, by the way. I know Terver said the government is trying. Yeah, if you work with the government facility, yes, they are trying. But how helpful are they to the private sector? That's my question. So my boss was like, no, we can't afford it. We can't afford PPEs. Everybody get your face mask yourself. Get your hand sanitizer. Get this, get that. So I feel quite unsafe. But I made up my mind to do something for myself. So I use my face mask at least, and I have my own hand sanitizer.
So the hospital does not provide hand sanitizer? Wow.
No.
And this is, I want to call our audience to say, this is a city hospital. that doesn't have a hand sanitizer, do you have your own gloves, or do they provide that in the hospital?
Most times they say, oh, we don't have gloves, you have to use nylon gloves, which are really not protective at all. So you have to buy yours most of the time. And this is a hospital in Lagos, not in, not in Abuja. I'm not in the village. That's what I'm addressing.
That's not, we're not even talking about the people in our persecuted areas, the people who have very basic hospitals. They don't even have hospitals, they have clinics. So I want to call attention to our audience to say we have boots on the ground. We have people who are standing attention to go distribute, especially in the rural areas, especially in areas that have been ravaged by persecution. We have people who are waiting to go help, to distribute masks, to give hand sanitizers. So go to iconhelp.com. Go ahead.
Can you just give masks also to the urban slums, not like villages, but urban slums, like where we work? And yeah, thank you.
Nkechi, we will definitely be bringing you back because there's so much going on in Nigeria, not just in the rural areas, like you said, but also in the urban slums. Thank you for taking this time to share with us, taking time away from your patients. I know that you have patients at work and patients at home, and you are taking time away to be with us. We are grateful to you. We appreciate you, and we hope to see you again.
Thank you very, very much.
All right. Thank you all for being with us. Yes, this was a longer conversation. We had two guests. We really wanted you to hear the perspective because as we deal with COVID here in the West, we want you to be aware how difficult it is in Nigeria with all the stuff that is going on, with the persecution, with the killings, but also with the poverty in the slums. How is COVID affecting them? And people are not just dying from COVID, they're dying from malaria, they're dying from things they don't have access to get tested for. You might be wondering, how can I help? You can specify as you give to iconhelp.org and say, give to this specific organization, give to this Nkechi Slum Hospital, give to this, Terver's testing organization, or we have volunteers who are giving their time to go to the most remote areas to distribute to share medical awareness and distribute medical supplies to protect them. So I just want to say thank you for this time. We want to build a community. So I have 3 things that you have to do, actions for the week. Before you see us next week, these are the 3 things we need you to do, okay? Follow us on Instagram. I'm going to have a competition. See, I'm going to buy the book that we talked about earlier. It's the book called The Next Jihad, Stop the Christian Genocide in Africa. And I'm going to give it to somebody I'm going to run a competition on Instagram and give it to the lucky winner. If you really want that book and you cannot afford to buy the book, join us on Instagram. How do you follow us on Instagram? Follow us on Instagram at Stand With Nigeria. At Stand With Nigeria. Very easy. Okay? Watch the Canon class. Y'all, I watched this. It's a 1-hour conversation with these 2 clergymen talking about their experience in Nigeria, and it shed so much light to what's going on in Nigeria. We're going to post a link to this YouTube conversation. We're going to post that link on our Facebook page. So if you're not following us on Facebook, it is Icon Help. Follow us on Facebook at Icon Help and watch this. Join the conversation. We're going to start conversations with this, okay? When you watch it, share it so that other people will get the opportunity. People will watch Nick Cannon before they watch me. I'm all that, but they will watch Nick Cannon before they watch me, okay? So share that. We want to get the word out. In case you're not willing to, win the competition and get the free book I'll be giving out, purchase the book, The Next Jihad, and take a picture of yourself with the book and tag us at Stand With Nigeria for a chance to win something special. I haven't decided what I want to give you. But take a picture, buy the book, tag yourself, tag us, hashtag Stand With Nigeria, and we will be getting back to you on that. Those are the 3 things you can do. Icon really helped to advise in the writing of that book. Icon had a lot to do with being part of the writing of that book. So take a picture. Buy the book first. Take a picture and tag us at Stand With Nigeria on Instagram. Y'all, it's been a pleasure. This has been a longer broadcast, but you know, I like hanging with y'all. I hope you like hanging with me too. These are heavy issues. We talk about it with a smile on our face, but we encourage you, follow us on Facebook and read the full articles of everything we discussed today. I love you all. It's been a pleasure. Have a wonderfully blessed 2021. Goodbye.